I remember right around Chinese New Year, Wuhan locked down, and that was, huge news for not only the world, but for a lot of our patients.
The impact for our community really started even before the surge that we had in New York City and the US. Many of our patients and residents in the community have close connections with their families and friends in China.
When the coronavirus hit our city, it was actually very scary. For us as healthcare providers, it was so much that was unknown about the virus.
Our community in Chinatown and in Flushing got hit very hard economically. The streets were empty, the businesses were really suffering, and these economic impacts have health effects. We have many patients and their families who are facing unemployment, who have lost their social supports, who have lost access to some of their health care as well.
Many of the community work in service industries, home health aides, nail salons, restaurant cooks, servers, even the small business owners, of which there are many, they've also been all disrupted. So how can they maintain their livelihood in this kind of environment?
Our health center has really risen to the occasion to meet the community and serve their needs.
We've been open every day to take care of patients. So if someone is ill, we can see them.
When many of the practices in our community were closed, we accepted their patients. If there were things that needed to be translated, messages that needed to be spread, we actually did all those things to help spread the facts and not so much the myths.
In addition, we've adapted to be more safe during this time for our patients. Distancing protocols, wearing masks, giving patients masks, keeping patients in rooms, cleaning the health center extra.
We converted almost 90% of our care to virtual channels. Almost overnight, patients could get their care by phone. They could call if they had questions. They could talk to a nurse. The nurse would triage them on the phone.
The health center has always been looking to figure out how we can start telehealth. And the COVID pandemic really gave us that push. In a couple of weeks, the whole health center started to do it. The patients really embrace it. They are able to reach their doctors to ask the questions that they need to ask.
Patients appreciate the fact that they don't have to put themselves at risk to see the doctor. It is something that we plan to continue. It is definitely going to be a component of the way we provide care, at least for the foreseeable future.
Our staff have really come through with flying colors. They are the heart and soul of the health center. They really want to help our patients. So they've pulled together, they've adapted under these difficult circumstances.
The guiding principle that we've held throughout this is we want to keep our patients safe, we want to keep our staff safe, we want to be open for our community during this time, and we want to do this in a way where we can rebound quickly and stay open for our community when they need us more than ever.
Not only that they have to deal with the anxiety and the uncertainty about what's going to happen, there are many staff that also need to juggle childcare, taking care of their family. But through it all, I think they're taking it in stride. We have a group of dedicated and also, compassion group of employees that are really supporting us throughout this pandemic.
My husband got COVID and was hospitalized for a couple of weeks. I always felt that I had my team backing me, and I didn't feel like I was alone. If I needed help, I felt like I could reach out to them and they would provide me the support.
It has been difficult. There's been a lot of balance of trying to figure out how to keep our staff safe, how to keep our patients safe, how to continue to provide good medical care to them, despite not being able to see them in person, despite not being able to touch them and to examine them. But we've adapted. And I think that's what everyone's been doing in this time. It's also helped to bond everyone together because we're going through this very difficult time together, but we're all working together and getting through it.
And I think it speaks true to the leadership of this organization. We quickly pulled together a team to address many of the issue and also coordinate the efforts among all the sites. It was just a collective effort of everyone to try to make this organization continue to function and be available to our communities.
I'm very proud of our staff being able to join together, be willing to change, because change is really hard, especially in times when there's a lot of confusion and fear and uncertainty. Our staff have embraced it.
I started in late February, and within 2 weeks, things really started to get pretty serious for COVID-19. I feel very blessed to have started when I did, because when our organization is in adversity, I get to see us at our best, and I get to see our staff really step up in amazing ways.
They all have great hearts. They really care about our patients, the community. They are part of the community. They are the community. So it's like taking care of themselves, their mothers, their aunties, grandmothers. So I want to keep them together. I want to keep our staff together, keep them whole, keep our health center going, alive and thriving for the community, for the next 50 years.